Great afternoon, Facebook family. How are you guys doing? I'm Ronique West, the president of the Greater Augusta Black Chamber of Commerce. As you can see, I have two special guests to close out Women's History Month with us. So I'm so excited to have our guests on today. We have Lisa Ann Wheeler and then Lauren, and I am not going to destroy your last name, so I'm not going to go there. Lisa Ann is going to actually introduce Lauren, but I'm going to let Lisa introduce herself here in a moment. But as you come into the broadcast, if you watch this after we get off live, make sure you share this out with especially the women within the Georgia area, Augusta, Georgia area, and so forth, because we know that health is wealth. We also know that making sure as business owners and entrepreneurs that we're taking care of our health is very critical. So we thought it would be best to close out Women's History Month with some resources that everybody can take advantage of to be able to make sure that their health is always, a top priority. And of course, if you want to join the chamber, you can go to www.myjbc.org. Our membership information is up there. Our events and what's coming up next for the organization is also up there. We do have our special conference call we hold weekly at 9 a.m. So we invite all you guys out to that conference call always, if you're a member or non-member, as we are an organization that is here to serve the community. So Lisa Ann, while I just make sure everything's happening on the back end and everything started, I see some people coming into the room. So go ahead and share out this broadcast and say hello to us so you can make sure everything's running smoothly. But Lisa Ann, if you can introduce yourself to all the listeners we have on live today with us.
Sure. Hello, everybody. My name is Lisa Ann Wheeler. I am the patient navigator for the Breast and Cervical Cancer Program here at the Department of Public Health. Our program has not had a patient navigator for 6 years. I'm fairly new. I've only been here a couple of months. And my job right now is to get this information out into the community. It's a phenomenal program. It allows women, provides mammograms and gynecological exams for women who are uninsured, underinsured, low income. The really great thing about our program is that if we bring someone in, they have a mammogram and there is an issue, they need additional views, they need an ultrasound, we cover all that too. Lots of times women will take advantage of a free mammogram, but if there's an issue and they need to go back, which does happen quite often, and not that there is breast cancer found, but they're just looking for additional views, women don't know what to do. They're not able to afford those additional views, an ultrasound, and so forth. So we cover the whole process. And sadly, it's just underutilized. So my job right now is just to get the word out and make women aware that this program is there for them, especially during the pandemic. So many women have lost their jobs, they've lost their health insurance, they can't afford COBRA, and it's been a year or more since they've had their annual exam. So that's kind of where we come in at the Department of Public Health. So I'm going to start with just some breast cancer statistics. The numbers are kind of scary. 1 in 8 Georgian women will be diagnosed with breast cancer in their lifetime. Breast cancer is the second leading cause of cancer deaths for women in the United States and in Georgia. And when I speak with women about breast cancer and deaths connected with breast cancer, women always think that it's the cancer in their breast that is kills them, but that's not it. It's metastatic breast cancer. Metastatic breast cancer is breast cancer that is spread outside of the breast to the bones, lung, brain, and other areas of the body. And sadly, every single 13 minutes, a woman dies of metastatic breast cancer. Early detection is critical. That's where mammograms come in. Cancers found earlier are much more likely to be treated successfully. We get them before they spread. A common area for breast cancer to spread is the lymph nodes in the axilla underneath your arm. And smaller tumors, when they're found, when they're quite small, usually that has not happened. So the earlier, the better for treatment purposes. Cervical cancer statistics in Georgia. Cervical cancer is the 12th most common cancer diagnosed in Georgian women. In 2020, approximately 440 new cases were diagnosed among Georgia women. In 2017, just over 120 Georgia women died of this disease. Through prevention initiatives such as early detection of precancerous abnormalities, meaning pap smears, and HPV vaccination, cases of cervical cancer have dramatically fallen in Georgia. And the combination of a PAP and HPV testing is amazing. It's just HPV is preventable. The HPV vaccine actually prevents cancer. And it's the only vaccine that prevents cancer at this point. Lauren will touch on that in a little bit. So our services, we offer clinical breast examinations, mammograms, pelvic examinations, Pap test, HPV testing and vaccines, diagnostic testing of abnormal results, and referrals to treatment through the Women's Health Medicaid program. So if, in fact, a woman has a mammogram or has a Pap and there is an abnormality found, we will guide them through the process of additional mammograms, an ultrasound, a biopsy, colposcopy. And if it's found that they do have cancer, we will refer them into the Women's Health Medicaid program so that they can have coverage and treatment for their cancer. So our mission is to help reduce the impact of breast and cervical cancer in Georgia. The DPH provides breast and cervical cancer screening, diagnostic services, and referrals to treatment as needed to underinsured and uninsured low-income women residing in Georgia. So here are the breast health recommendations, and they vary quite a bit between providers and who is actually, so American Cancer Society has certain parameters. The National Breast Cancer Coalition, they have other recommendations, but this is what we stand with at the Department of Public Health, is women ages 20 to 39 have a healthcare provider perform a clinical breast exam every 3 years. And women age 40 plus have a healthcare provider perform a clinical breast exam every year. And mammograms should start if it is felt between the patient and the provider that it is time. Some women wait to 45. It depends on if there's a family history in your history of breast cancer in your family or not. That can kind of make a difference there too. That's something that you can talk with your provider about. But we suggest over the age of 40. Gynecological exams, all women should begin cervical cancer screening at age 21. Women ages 21 to 29, we suggest a Pap every 3 years. Women ages 30 to 64, Pap test every 3 years, or HPV test and Pap test combo every 5 years. Women over 65, no further testing if you've had 3 normal Pap test results in the past 10 years. In closing, the breast and cervical cancer program eliminates some of the barriers that prevent women from seeking regular wellness exams, allowing them to take care of themselves and make good physical health a priority. I really, really believe in this program. It has made such a difference in the few patients that I've had a chance to work with. Women that have been unable to get a mammogram for 5 or 6 years, and this allows them to have their mammogram, and it's just such a sense of accomplishment for them, for taking care of themselves. It seems like we women take care of everyone else, and it kind of let ourselves fall to the bottom of the barrel, and it feels good when they take charge and go in and they have an appointment in our clinic, have their wellness exams, have their mammogram, have their Pap test. So I really like to think that we're making a huge difference, and I look forward to working with our community to get the word out and to just kind of bring those women in that are needing our services. So I thank you for your attention. I'm going to turn it over to Lauren. Lauren, you can introduce yourself, my dear, and a little bit of your history. We connected through my work with the National Breast Cancer Coalition, and she will tell you about Grit Health and all the wonderful things that she's doing. So Lauren, I'll give it over to you.
Thank you, Lisa, and thank you to the Chamber to also having me on today. What a wonderful way for me to close out the month. As mentioned, Women's Health Month, Health History Month, why not? So my name is Lauren Lastauskas. I am a cervical cancer survivor, and I'm also the program director at Grit Health, pronounced Grit, but spelled Gryt. And so my story and kind of how I got involved was obviously a cancer diagnosis. So I was diagnosed with, let me back up. I was born and raised in South Carolina, so very close ties to Georgia with family and friends there as well. A lot of the same initiatives and programs happening in South Carolina as Georgia. Really great to see, different states working together, and programs through the public health department are so important. And I'm going to tell you a little bit as to why. So I was diagnosed with cervical cancer about 2 weeks after I turned 23. So this was back in 2016. And prior to that, I had followed the guidelines. I received my first pap test when I was 21, and it was normal. And then my insurance changed, and I was due to go have my birth control refilled. So at that time, they said, do you want another pap test? Do you want a full gynecologic exam? And I said, you know what? Why not? My new insurance is going to cover it. You're already down there. Do your thing. So had another pap, and that was about a year and a half after my first one. So I really wasn't due for another year and a half. And so that pap test came back with high-grade abnormalities, which you don't want to hear. It's something that's not really talked about a lot. Until I started publicly sharing my story, did I realize I had so many family members and friends and women in the community of all different ages and races and backgrounds who came out to me and said, I have had a bad pap test, or I have tested positive for HPV. So you're not alone in that at all. So that came back high grade. And then I had to go through, as Lisa Ann mentioned, a really fun procedure called a colposcopy, which is where the gynecologist will take a closer look at your cervix and biopsy any suspicious looking areas. Not fun. It's done in office. And so that actually came back with high grade abnormalities as well. So then I was scheduled for my first surgery. And this actually took place while I was in college. So I was actually on my Christmas vacation, and I had to have this done. So I went in for what's called a LEAP procedure. And so that procedure is an electric cauterization of a piece of your cervix. And so with that procedure, they found some more cancer, but the margins were clear. And it was recommended to me to just come back in another 3 months. But fortunately, at the time, I was actually working as a healthcare provider in a different OBGYN office. And it just didn't really sit well with me knowing that they just found cancer. So being educated enough to speak up, I asked for a referral to see a gynecologic oncologist. So I had to go about 2.5 hours to go see an oncologist. And it was at that time he did a PET scan, and he wanted to do a second, more invasive surgery called cold knife cone or cold knife conization. And that's where they take a bigger piece of your cervix. So in that, they found more cancer, but the margins, so the outside of the cancerous part, was not clear. So they didn't really know how far my cancer was in my cervix. So that took place my spring break of my last year of college. Not really how most 20-year-olds, people in their 20s want to spend their spring break. Certainly not what I anticipated. So I had that done, and about 2 months later, I underwent my final surgery on May 20th of 2016. I had a radical hysterectomy. So what that is they removed my cervix, my uterus, my fallopian tubes, the upper third of my vagina, surrounding tissues, as well as 23 pelvic lymph nodes. So big surgery. And with that, obviously my uterus being removed, I was left infertile. So I can no longer carry my own children. And that's, again, something you don't think about at 23. Nothing like that should happen to someone at that age or later in their 20s or their 30s, 40s. And the reason I'm so open and telling my story is now May of this year, I'm going to hit the 5-year mark of being cancer-free.
Congrats.
Thank you. And I'm so open and vulnerable, and I tell my story because this could have been completely prevented. The HPV vaccine came out in 2006 when I was actually 14. And so I could have and should have received that vaccine. Unfortunately, my pediatrician at the time did not have that conversation with my mom. And I can 100% tell you that if I would have had the HPV vaccine, none of this would have happened. I wouldn't have gone through cancer. I wouldn't have lost my fertility. I wouldn't be dealing with side effects down the road that I still deal with now, that I don't feel like a normal 28-year-old today. I've gone through way more than I could have ever anticipated. And my cervical cancer was indeed HPV strain 16 positive. And that is one of the strains covered in the vaccine. So if I would have gotten that, this could have been completely prevented. So that's really why I tell my story, and that this doesn't have to happen to women at all. We have a vaccine, as Lisa Ann said, that is cancer prevention. You can do something for yourself and your children. Boys and girls can receive it, and this can be completely prevented. And the programs like Lisa Ann mentioned, where you can go and get this done and have assistance in getting this done, are so important. It is so important to keep up with your regular breast and cervical cancer screenings, because in my example, I had a normal pap. A year and a half later, down the road, things were abnormal. So at that 3-year mark, it would have also been caught. But if I would have ever waited past the recommended amounts of time, I probably wouldn't be here today alive. So I cannot stress enough how important it is, and how wonderful these departments of public health in different states, whether you guys in Georgia, me in South Carolina, all over, these different initiatives that help you get these screenings, stay on time with these screenings, and then ultimately, as Lisa Ann said, that follow-up. So all those little surgeries I had to have and tests that I had to have done, having the Georgia Department of Health cover those, that is so important, because if I would have ignored those, then again, I probably wouldn't be here today. And I can promise you that getting the HPV vaccine and staying up to date on your screenings as a woman, and telling your friends, telling your girlfriends, telling your family, your sisters, your aunts, your nieces, going in for that pap test and also getting the HPV vaccine, I promise you it's a lot less stressful, a lot less burdensome than everything I had to go through. And so me telling my story, if it can help one of you realize you're behind on your testing, and if you can leave this Facebook Live today and go make yourself an appointment to follow up for your breast and cervical screenings, then I can say I've done something really great. And so I kind of took my cancer journey and became an advocate, because I love telling my story. Like I said, even if it's just one of you, that is why I do this and put myself out there. So I was lucky enough to work with a few great nonprofit organizations, such as Survivor, which is CERVIVOR, an organization that helps women be educated and become aware of cervical cancer and HPV vaccines. And as well, I now work for Grit Health, which is a digital oncology company, and I'm their program director. So I get to do really amazing things, similar to this Facebook Live, of bringing experts in and different nonprofits and really sharing information with the cancer community. And so I am just so lucky to be here today alive, cancer-free, and also be able to continue what I'm most passionate about through my work and through networking and meeting people like Lisa Ann, and then getting in front of you today. So I hope my story can inspire you to really feel empowered and be in charge of your own health and pay attention to your body. And again, I'm so thankful to have wrapped up this wonderful month this way on this beautiful day. So thank you all for having me. And yeah, thank you.
Thank you, Lauren, for first off sharing your story. Congratulations on being cancer free. That was a powerful testimony. And I just love the fact that Lisa Ann brought you on, and that Lisa Ann is sharing and already being so active in our community. She reached out to me a couple of months ago, even though she's new in her position, just to make sure that you're spreading out the free screenings that are available. And I said, of course, we want you on, because we know that as women, a lot of times we do put ourselves last. We're, especially for business owners or entrepreneurs, we're running our businesses, we're taking care of our families, we're doing what we may be doing in the community. And then a lot of times we're not taking care of our health. So as a chamber organization, we focus on business, community, and government. And this is part of that community aspect. And so we have a whole Health is Wealth initiative that we're starting off next month, where you can actually come, in May, and hear from a health expert. And then we're going to do exercise for 20-30 minutes, because we're going to really lead by example to make sure that our community is starting off their month healthy. And that just continues to go out through our community. So we're just excited to be able to have you two ladies on today, and to close out Women's History Month with this such a critical topic. You cannot pour from an empty cup. If you're not well, you can't give the best of yourself. It is very critical that I always tell women, I always encourage them, like, make sure you start your day with yourself. Make sure you schedule your appointments, you schedule everything else. You have to schedule that time for yourself and hold yourself accountable to get these things done. Lisa Ann, what else do you want to add to this conversation? I know you're doing double duty, so I don't want to keep you on too much longer, but I want to make sure you close out properly and give us any closing information before you have to drop off.
Right. Well, so Lauren, I just want to go back to what you had said too. There is this stigma about HPV that I hear all the time. I'll show women a list of things that we offer HPV testing. They'll be like, "Oh no, I don't want that." Well, I can guarantee you probably had it, and your body's probably cleared it. 80% of us have had it at some time in our life, and where Lauren is affected with a certain strain, and people don't understand certain strains are more virulent than others. And the fact is, there is a vaccine out that can prevent this. And I wear my voice raw, beating the drum and yelling it to the masses, because get your kids vaccinated, get yourself vaccinated. They've even extended the age to 45 now. You can still get HPV vaccinations, and it's a no-brainer. Lauren, you're with me here? I mean, it's just a no-brainer. It prevents 7 types of cancer. So why wouldn't you want to give your child that? And let go of the stigma, because really that just has to go to the wayside. Protect your kids, protect yourself. And like you said, you can't pour from an empty cup. Take care of yourself. Get those screenings. Get those vaccinations. Do the things that are important to keep yourself well, so that you can live a good, productive life, taking care of those that you love.
I agree. Lisa's Ann information is up on the Facebook Live, just in case anybody wants to reach out to her in the community. Take a screenshot of this information. If you have any friends, family members, or anything that has concerns and want to be able to schedule some screenings, and they don't have health insurance, or a lot of business entrepreneurs, they're either may get health insurance through the marketplace, some of them do not. So make sure you save this information so that you can share it out with your family and friends. Share out this broadcast. We wanted to close out Women's History Month really powerful, as the team has been delivering things all month, but we wanted to make sure we close it out with health, which is such a critical topic, because that's the top thing that we have to take care of so we can deliver to our community. So ladies, I enjoyed you today. I'm so happy that you guys took the time to come on to this live and share this information that is so critical for our community. And thank you, Lauren, again, for sharing your story. Continue to do the great work that you're doing out in the community over in South Carolina. We actually do cover the CSRA area, so we cover business owners and entrepreneurs in that area as well. So that is great information you've shared out. And there's anything that you would like for us to send out, please let us know so we can get it out to our community and our constituents and our members and non-members. And then Lisa Ann, again, it's been wonderful to have you on today. I appreciate all that you're doing for the community.
Thank you. This has been so powerful and wonderful. Lauren, always good to see you. Always good. I'll see you next week after. I know we're going to do something else together. So great. Honey, thank you.
Awesome.
Gracious.
Thank you.
Really
Thank you. Thank you. Thank you, guys. Thank you. And I'm gonna go ahead and close out just really quick, just in case you guys need the information for the chamber. You can go to our website, and then you can go to our link tree to sign up for our upcoming events. At linktree/mygabc. And then, of course, reach out to the team. We'll be happy to help you. Remember, our Friday calls every Friday at 9 a.m. That is our weekly update. And that way you can see what upcoming events we have coming up. We have a lot jam-packed for 2021. So I'm not going to go through all the events that are coming up, but we're just so happy to close out Women's History Month. And that's the best way to get connected with us. Also, you can sign up for our email list on our link tree. If you're not a member, I suggest you definitely sign up for our email list, because we're sending out great information, like the information you see today, the information to contact, business owners, PPP updates. We did that live last week. So you're getting all the information you need on a business, community, and government level from your Greater Augusta Black Chamber of Commerce. I'm Ronique West, the president. Thank you to ladies for joining us this morning. This afternoon actually is now noon. And then I want everybody to have a great rest of the day and great weekend. Just be safe out there, guys, and be sure you take advantage of these resources that we have in our community. So critical, that we just take care of our health and so forth. And remember, we are one community, one voice, and the voice of Black business. I bid you good day. Thank you, everyone.
Thank you. Bye.